This is very much a community hospital for Portland. At the same time, we are the referral center for the state of Maine. And you don't see a lot of places that really authentically perform both of those functions.
You have a really good balance between critical care, general internal medicine, and outpatient setting here.
This program blew me away. I was really impressed by how heavy the academic training is.
I was looking for somewhere that combined the academic rigors of a big city program with a little bit of a slower pace of life.
We have patients from all over the world that have come to Maine as refugees, but we also have tremendous socioeconomic diversity in the state of Maine. We offer a tremendous diversity that you really don't see in a lot of medical centers.
People can expect really good balance of having some autonomy as an intern, learning new things, with also a lot of supportive culture with everyone in the residency.
Intern year is very hard. We start off our year with a coach, and that's a faculty member that helps to basically help you navigate those waters.
So I felt completely welcomed from day one. From the support staff to the co-residents to the attending physicians have all just been really approachable and really willing to help.
We also have a buddy system, which is a senior resident that helps to navigate the part of medicine that we don't really know as much about.
All the people that teach here are doing it because that's what they want to do. It's an important part of their career, and I think that comes out in the quality of the teaching they provide.
The size of our program helped us to know everyone on a personal level.
I just absolutely fell in love with the people here, everyone who works here, the faculty. They're just very well trained, really supportive.
The pathology and the complexity of patients that I saw here in Boston was very similar to what I used to see in my residency at Maine Med.
We've really tried to get our residents outside the walls of Maine Medical Center into Portland. They work in the city of Portland clinics.
So the Preble Street Learning Collaborative is a joint effort between Maine Medical Center and Preble Street, which is the social services agency in town that cares for people experiencing homelessness. It's really an opportunity to hear people's stories, try to understand the world from their perspective, to push back your compassion buttons and put that back into place.
They work in the VA system. All of our residents rotate in our rural member hospitals around the state.
The program has set me up very well to feel very comfortable in both an inpatient and an outpatient setting.
There's several different clubs here. I'm part of the Women in Medicine, and we have mentorship that helps women foster this growth, especially in a traditionally male-dominated field.
I've been really pleasantly surprised to see that I have such a nice work-life balance.
That's been actually super important to me. I have a very reasonable amount of time off, and I get to do a lot of things that I really enjoy.
Portland itself is just absolutely phenomenal in terms of a place to live, so many nice things to do.
You can leave work and within 5 minutes you can be running or on your bike or over at the beach.
Was kind of amazed by how many beaches there are within the surrounding towns of Portland.
We do a lot of camping, hiking, ice skating, and snowboarding and skiing, and then in the summertime we go sailing.
I actually learned to fly fish. I'm a huge foodie, and so Portland has such a great menu. I have a list of places I want to go to, and I'm just slowly ticking them off.
And the city has all of the amenities of a bigger city with kind of the small town feel and the affordability of somewhere a little more rural.
We always think of ourselves as a hidden jewel kind of a program.
When you choose a program, you look at the residents and you see how happy they are in their field and in the community that they're in. And if that can provide the clinical diversity and knowledge that you want to become that doctor that you've been dreaming to be.
I remember walking out and meeting my wife on the Western Promenade and saying, this is the one. And it has not let down since day one.
I am so happy with my choice. Every day when I'm biking home or walking home for work, I'm like, this is where I'm supposed to be.